Okay, so today we're going to be talking about the disease pancreatitis. So I'm going to start off by talking about the pathophysiology. So digestive enzymes, carboxypeptidase, chymotrypsin, and trypsin stay in the pancreas instead of releasing into the duodenum. Which leads to enzyme escaping into the surrounding tissue, causing inflammation in the pancreas. In acute pancreatitis, it occurs in middle-aged adults associated with gallstones in women and alcoholism in men. Some symptoms of acute pancreatitis are severe pain in the epigastric area that often radiate to the back, and a trigger presents suddenly after eating a fatty meal or consuming excessive amounts of alcohol. For chronic pancreatitis, it's associated with alcoholism, and because alcohol promotes the insoluble proteins to form, which then block the pancreatic ducts, leading to the buildup of pancreatic juice that sit to damage pancreatic tissues and lead to the inflammation. Some chronic symptoms can be seen in chronic epigastric or left upper quadrant pain, anorexia, nausea, vomiting, and weight loss.
Now for pancreatitis. The pathophysiology is very simple. In pancreatitis, we have inflammation of the pancreas. So anytime you see the word itis, just think inflammation. So in pancreatitis, this inflammation comes from autodigestion of the pancreas. Basically, the pancreas's own digestive enzymes have accidentally activated early. Now, as you know, the main functions of the pancreas is exocrine and endocrine. The exocrine part is to produce digestive enzymes, which helps break down food and is a critical part of digestion. And the endocrine is for secretion of insulin and glucagon to stabilize glucose balance, which we cover in the diabetes lectures. Now, the enzymes are the key here. They are like ticking time bombs to break down and digest food. But when they're activated early inside the pancreas, they actually digest the pancreas. So the three key enzymes to know is protease, which breaks down protein. Lipase, one of the biggest affected by pancreatitis, breaks down fats. So just think lipids and lipase, lipid for fat. And lastly, amylase breaks down carbs or carbohydrates. Now, if the pancreatic duct is blocked for any reason, say from inflammation in liver cirrhosis, or hepatitis, or let's just say a gallstone has floated down and got stuck, well, this means that the enzymes can't get out of the pancreas and into the intestine, and accidentally prematurely activate within the pancreas. It's kind of like having a pirate ship, and you know how they shoot out cannonballs. But what if those cannonballs explode within the pirate ship and sink your ship? Well, in the same way, it's kind of like having these enzyme bombs exploding inside the little pancreas here, causing supersized inflammation as the pancreas digests itself. This is what is meant by autodigestion. Now, the causes are very simple. Again, think anything that can block this little tiny pancreatic duct. As you can see, we have a lot of organs closely fitted together here, kind of like an apartment complex. They all share this common bile duct, which branches off into the pancreatic duct here. So, common causes is alcohol abuse from years and years of inflammation, which ends up inflaming the little duct and occluding it, or basically blocking it. Now, gallbladder disease as well, we talked about a gallstone or even inflammation that now blocks this duct.
And our medication is Pancrelipase, and the purpose of Pancrelipase is that it is used for replacement therapy for individuals with insufficient pancreatic exocrine secretions. This condition can occur in diseases such as cystic fibrosis and pancreatitis. This medication contains certain enzymes such as amylase, protease, and lipase, which are all derived from pork products. These specific enzymes help in the digestion of carbohydrates, fats, and proteins. Pancrelipase is taken orally in different forms such as powder, capsules, or tablets. The capsule dissolves in the alkaline environment of the duodenum, releasing the enzymes. The mode of action of Pancrelipase is that the enzymes act locally in the gastrointestinal tract, and they are not absorbed into the bloodstream. When taken orally, Pancrelipase supplements the body's natural enzymes, which aids in digestion of nutrients. This is beneficial specifically for individuals with pancreatic insufficiency due to the pancreas not producing enough enzymes. Once ingested, Pancrelipase works in the small intestine. The enzymes then become active due to the environment of the intestine, and this helps them break down the dietary fats into fatty acids and glycerol. This also breaks down proteins into amino acids and then carbohydrates into simple sugars.
The administration of this medication, the route is oral. It's in capsules, tablets, or powder for suspension. The timing of this medication you want to administer with meals or snack or a sufficient amount of water to ensure proper enzyme mixing with the food. For special instructions, you do not want to crush, chew, or hold the capsule in your mouth as the enzymes can irritate the oral mucosa. You want to swallow or open the capsule and sprinkle the contents of the capsule on acidic soft foods such as applesauce, no dairy or alkaline food. The dosage is individualized based on fat content in the meal and severity of enzyme insufficiency. You want to monitor nutritional status, stool consistency, and weight to evaluate for effectiveness. The common side effects are nausea, vomiting, diarrhea, and abdominal pain. You'll also see bloating, gas, and constipation from high doses. Headache and dizziness may also occur. Some more serious and less common effects are fibrosing, colonopathy. This is rare, especially in cystic fibrosis patients on high doses. Hyperuricemia and hypouricemia. You want to evaluate uric acid levels. The allergic reactions may also be common side effects, especially in patients allergic to pork protein. Oral mucosa irritation and ulceration if tablets are crushed or chewed. And for black box warnings, there is no current black box warnings on this medication according to the FDA.
So the medication Pancrelipase, some interactions of medication would be antacids, oral iron supplements, folic acid, and acarbose, which is a oral prescription that is used with diet and exercise to treat type 2 diabetes. Treatment of overdose of medication. There's not a specific antidote, but we do want to manage symptoms and be supportive. So the first thing that we would want to do is stop Pancrelipase immediately. Maintain hydration to prevent uric acid related complications. Monitor lab values, serum and urine uric acid levels, and signs of bowel obstruction or constipation. Manage symptoms and educate patient on proper dosage and administration to prevent reoccurrence. Some priority roles as nurses would be assess baseline nutritional status and bowel patterns, evaluate abdominal pain, stool consistency, and weight gain or loss, check for signs of malabsorption, monitor uric acid levels, administer with meals and snacks, never on an empty stomach, do not crush or chew medication, encourage adequate fluid intake, and avoid concurrent use of antacids or iron supplements at the same time as the enzyme.